Hi, my name is Elizabeth Lanier, and I will be talking about increasing patient safety by decreasing the incident of patient falls. Falls are occurring much more than they should be. On the unit that I work on, just in the last month alone, there have been 2 patients that have fallen. According to the Joint Commission, every year in the United States, several patients fall in the hospital, leading to significant health consequences, even death. Patients who are at risk for falling may be confused, impulsive, have an unsteady gait, changes in vision, and also loss of strength. Some of the most common contributing factors for patient falls are inadequate assessment, lack of leadership, deficiencies in physical environment, failures in communication, and lack of adherence to protocols and safety practices.
So what is supposed to happen? There are existing strategies implemented on my unit to prevent falls from occurring, but these are happening on a rare occasion. Check-ins are assigned every shift, one being a fall champion. A fall huddle is also to be completed at every shift start to determine the risks of fall patients on the unit. This never happens. Since I've started in April 2016, I've only experienced one fall huddle. Fall risk assessment is a documented intervention that must be completed every shift. This generates a fall sheet that is used during the fall huddle, so the fall risk patients can be identified by the fall champion. The fall sheet is used then to ensure that those who are at risk for falls have identifiers such as a yellow bracelet, yellow socks, the yellow falling star on the door. The most important task is making sure that the bed exit alarm is on. The completed fall sheet will be initialed next to each patient, indicating that they have been checked. It will be signed with the date and time that the nurse completed the task and placed in the fall binder. So this is the fall sheet. Just to give you an idea of how often this is not done, this picture was taken Sunday, October 8th. So I was the last one to complete this task 2.5 weeks prior. What is happening and what is supposed to happen are completely different. This fall risk assessment is the only thing that's being consistently done, as it is necessary patient documentation. Nurses are not implementing the strategies that they are documenting that they are doing to prevent falls. I chose the IHI model for improvement as the guideline to improve this patient safety concern. Our aim is to increase patient safety by decreasing patient falls in a 20-bed critical care step-down unit in a busy local hospital to 1 patient fall in a period of over 3 months. We will know that a change is an improvement when there is 1 patient fall or less over the established time period of 3 months. 3 strategies will be used to decrease patient falls. These will be measured by obtaining reports from the unit manager on falls on a monthly basis, as it is company policy for the falls to be reported to unit managers. In order to detect measures of success, I will obtain the amount of falls for 3 months prior to the strategies being implemented and compare those statistics to the amount of falls that have occurred afterwards. These findings will also help determine the changes that must be made after the testing period in order to have a more successful outcome in the next trial. Strategy number 1, education. All staff and patients will be educated on the risks for falling and the strategies that will be used to prevent patient falls. Coppedge, Connor, and C in 2016 stated that promoting staff and patient education on fall risk assessment and plan of care for fall prevention has been identified as one of the best practices in preventing patient falls. In order to implement strategies, the staff meeting will be held to educate and make all aware about the importance of preventing falls and the new practices that will be implemented. Strategy number 2, check-in duties will be modified and the charge nurse will also be involved in enforcing the changes. The fall champion will perform existing duties and responsibilities will be added. Added responsibilities include ensuring that the fall risk box on the patient's whiteboard is checked, the patient environment is clean and clear of clutter, the amount of times that the fall risk patients will be checked will increase to every 4 hours rather than just the beginning of the shift. One other person will also be responsible for doing a double check on the fall champion's duties every 4 hours at different times. Both responsible parties will initial and time the patients that they check on the completed fall sheet. The charge nurse will also be responsible for implementing fall huddles at the beginning of the shift, right after handoff report is given, and also verifying that the fall champion duties have been completed. Strategy number 3, fall precautions will be re-implemented and modified. In 2017, Harrison states that the implementation of fall prevention programs decrease fall risk and promote interprofessional care. Staff will also now be required to communicate during handoff report which patients are at risk for falls. Per the Joint Commission, communicating patient risk for falls between caregiver and applying standardized practices and interventions are effective ways to reduce patient falls. Staff will also take turns staying in the hallway when there are several high-risk fall patients on the unit. Nurses with new admissions will be responsible for checking bed exit alarms are working properly prior to a patient's arrival to the unit and placing fall risk identifiers on the patients that do not already have these in place. All staff will now be responsible for ensuring that the patient's rooms are clean and clear of clutter. Ultimately, the goal is for nurses to play a better role in preventing patient falls, leading to an increase in overall patient safety.